This webinar aims to revolutionize how we understand and address menstrual wellness. By equipping ourselves with the knowledge, we can effectively advocate for our needs, make informed decisions about our health, and take control of our hormonal and reproductive well-being. Through the implementation of holistic solutions, we can potentially alleviate long-standing symptoms that may not have been adequately addressed by conventional options. So, the menstrual health and hormonal balance. Our menstrual cycle is a vital sign giving us a window into our overall well-being. It involves an intricate hormonal dance between the hypothalamus, pituitary gland, ovaries, thyroid, adrenals, and more. Disruptions to this delicate system ripple into widespread consequences. Understanding healthy hormonal pathways equips us to spot imbalances early on and pursue nourishing solutions for harmony. Let's see what's the impact on working women, housewives, and students. The hormonal issues like PCOS, endometriosis, fibroids, etc. can cause really debilitating symptoms. From unpredictable cycles, migraine headaches, and iron deficiency anemia to infertility, obesity, anxiety, and depression, the burden is really heavy. The spectrum ranges from challenging to excruciating. Without solutions, we endure needless suffering. Student productivity plummets. Professional calls out sick frequently while homemakers silently bear the load. Destigmatizing and proactively managing menstrual health means reclaiming vitality in all domains of life. The time for change is now. Let's understand the menstrual health. There are various phases of menstrual cycle. First, of course, is the menstruation. It's the time when you get your periods. The uterine lining sheds off, resulting in the bleeding. It usually lasts for 3 to 7 days. The next phase is the follicular phase. It begins on the day you get your period and ends at ovulation. Usually, only one follicle will mature into an egg. FSH stimulates your ovaries to produce small sacs called follicles. These follicles contain the immature egg. Estrogen rises and your uterus lining also thickens. Follicles will form a fully mature egg eventually. The next phase is the ovulation phase. It is the time when your ovary releases a mature egg. It usually occurs around on day 14 of a 28-day menstrual cycle. Rise in estrogen levels increases the luteinizing hormone. The next phase is the luteal phase. After ovulation, the ruptured follicle transforms into corpus luteum, which produces progesterone. This phase prepares the uterus for possible implantation of a fertilized egg and can last for about 12 to 16 days. Progesterone hormone rises. In case pregnancy doesn't happen, progesterone and estrogen levels go down, the uterus lining sheds off during your period. Now let us see what are the common issues which are faced. So first of all, in menstruation, the most common issues experienced are the cramps, of course, the bloating, headaches, and mood changes. In follicular phase, some individuals may experience mood swings, breast tenderness, and increased libido. During the phase of ovulation, women might feel pain or slight increase in vaginal discharge. And the last phase is the luteal phase. And the common issues faced during this phase are the premenstrual syndrome symptoms or the PMS symptoms, such as bloating, breast tenderness, irritability, and fatigue. Now, let us discuss the role of hormones. Hormones play a vital role in regulating the menstrual cycle. As we have just discussed, estrogen levels rise during the follicular phase, stimulating the growth of uterine lining and the development of a new follicle. The ALH hormone surges during ovulation, triggering the release of the egg. And finally, the progesterone. The levels increase during the luteal phase, preparing the uterus for pregnancy and maintaining the uterine lining. Now, the hormone fluctuations are responsible for various changes and symptoms experienced throughout the menstrual cycle. Now, let us discuss PCOS or PCOD. How is it caused and how is it related with the hormones? Polycystic ovarian syndrome is a hormonal disorder that affects women of reproductive age. The various pathologies behind it is first insulin resistance. Many women with PCOS have insulin resistance where the body cell doesn't respond normally to insulin. Elevated insulin levels can stimulate the ovaries to produce more androgens, and androgens are the male hormones. Now, these male hormones rise in women who have PCOS. Because of this, they may have excessive hair, they may have acne, irregular menstrual cycles as well. The next hormone is the LH hormone or the luteinizing hormone. In PCOS, there may be an imbalance of LH, which is involved in the regulation of the menstrual cycle. Elevated levels of LH in relation to FSH can disrupt the ovulation. Next comes the most important hormones, the estrogens and the progesterones. PCOS can lead to imbalances in estrogen and progesterone, which can cause irregular menstrual cycles, and it might also affect fertility. AMH, anti-Mullerian hormones. A high level of AMH suggests the severity of PCOS in women. Now let us see what are the symptoms of PCOS. First, irregular periods or skipping of periods totally. Second, excessive hair growth on face and body, facial acne, darkening of the skin around neck under the breast. There could be sudden weight gain as well. You might feel mood swings and irritability. Now let's see what could be the consequences of PCOD. The major consequences could be on your fertility. Disrupted ovulation makes pregnancy a real challenge. Endometrial cancer. Estrogen imbalances raise the risk of endometrial cancer. You might also develop diabetes later on in life due to insulin resistance. PCOS patients are also predisposed to heart issues because there is cholesterol imbalance and high blood pressure. You might have sleep apnea. Disrupted breathing during sleep is pretty common in PCOS. Pregnancy risks, gestational diabetes and high blood pressure are more likely. Miscarriage and prematurity both occur more frequently with PCOS. So how does the appearance change? Excess androgens cause unwanted hair growth and acne. Now let us see how it disrupts you holistically. So first is fatigue and a constant low energy. PCOS can drain your physical and mental reserves, making everyday tasks really difficult. Emotional and mental health take a hit. Anxiety and depression is frequently observed, affecting relationships, work, and overall well-being. Sleep is often elusive, resulting in feeling of restlessness and irritability, further impacting energy levels and mood. Now let's see what are the day-to-day challenges that you might face. From battling unwanted hair growth to controlling acne, juggling medications and navigating dietary restrictions, it's a constant challenge. Dealing with body image concerns, explaining PCOS to others, and facing insensitive comments can be emotionally really draining. Fertility concerns and the possibility of long-term health complications add a layer of worry to life decisions. Now let's see what are the holistic approaches to management. What is holistic health first of all? Holistic health is a philosophy and approach to well-being that considers the whole person, not just their physical body, but also their mental, emotional, social, and spiritual dimensions. It's about understanding how these different aspects are interconnected and how they all contribute to overall health and happiness. Now, Holistic approach on menstrual health. The various aspects that we are going to see are the yoga, Ayurveda, hygiene products, and of course, the diet. Menstrual health isn't just about managing cramps and periods. It's about creating a holistic experience that honors your body's natural rhythms and nurtures your well-being on all levels. Now let us discuss few key elements of holistic approach. First is the yoga. Gentle yoga postures. Vinyasa flows can be adjusted for menstruating bodies, promoting circulation, easing cramps and releasing tension. Restorative yoga, garland pose, cat-cow pose, butterfly or bound angle pose. They all encourage deep relaxation and introspection, fostering inner peace and reducing stress. Pranayama. Breathing techniques like Ujjayi Pranayam can regulate hormones, decrease anxiety, and energize the body. Ayurveda. Dietary adjustments. Now balancing doshas with warming spices like ginger and turmeric, eating light and easily digestible foods, and reducing cold and processed food can minimize your discomfort. The herbal remedies. Herbs like ashwagandha and shatavari can support hormonal balances, relieve pain, and boost energy. Abhyang. Massaging with sesame oil promotes circulation, improves mood, and releases stress, enhancing overall well-being. Now let's discuss about the hygiene of the intimate area. So definitely opt for cloth pads, menstrual cups, or period underwear to reduce wastage and potentially elevate symptoms associated with disposable products. You can switch to more natural and organic options like choosing pads and tampons made from organic cotton and free from any harsh chemicals to minimize irritation and overall promote genital health. You need to prioritize your cleanliness. Maintain proper hygiene during menstruation to prevent infections, using gentle washes and changing products regularly. Now, coming on to the most important aspect, the diet. Nutrient-rich foods must include fresh fruits, vegetables, whole grains, and lean protein to provide essential vitamins and minerals that support hormonal balances and energy levels. Fiber-rich vegetables like broccoli, cauliflower, and spinach, lean proteins like fish, tofu, skinless poultry, and lentils build muscles, promote feeling of fullness, and reduce your cravings, thereby stabilizing blood sugar levels. Healthy fats, which includes nuts such as almonds and walnuts, and seeds like flax seeds and chia seeds, lower inflammation and promote hormonal balances. Low glycemic index carbohydrates, for example, brown rice, sweet potatoes, quinoa, oats, they all digest slowly and stabilize your blood glucose sugar. Antioxidant-rich fruits like berries, cherries, and all the colorful fruits, green leafy vegetables such as kale, spinach, and broccoli. They are rich in vitamin K, folate, and iron. Dairy alternatives. Plant-based milk like almond milk or soy milk are better. Go for herbal teas like green teas because they improve insulin sensitivity. Chamomile has a very calming effect, and spearmint, which has an anti-androgen effect as well. Now, let's also look at the foods to avoid. Of course, the processed foods, excess sugar and salt, sugary snacks, fast food, refined sugars, and unhealthy fats. Of course, soft drinks and energy drinks are also a big no. Excessive caffeine and red meat. Remember, hydration is the key. Drinking plenty of water and herbal teas aids in detoxification, prevents bloating, and keep your body functioning optimally. Eating mindfully. Listen to your body cues and eat right, avoiding sugary treats and processed food that can exacerbate PMS symptoms. Now let's see how to reverse PCOS and hormonal imbalances holistically. The first and foremost is the lifestyle modification, which most importantly includes diet. As I discussed, prioritize whole, unprocessed foods rich in fibers, antioxidants, and healthy fats. Reduce sugary drinks, refined carbs, and unhealthy fats. Aim for a balanced Mediterranean or DASH diet. Second, exercise. Regular physical activity, especially moderate intensity exercises like brisk walking, swimming, cycling, helps regulate insulin and overall improves your health. Aim for at least 150 minutes of moderate intensity exercise per week. Stress management. Chronic stress can increase hormonal imbalances. Practice stress reduction techniques like yoga, meditation, deep breathing, and spending time in nature. Aim for 7 to 8 hours of quality sleep each night. Maintaining a consistent sleep schedule is crucial for hormonal regulation. Weight management. Losing small amount of weight can significantly improve your PCOS symptoms. So focus on healthy eating and exercising rather than restrictive and crash diets. Now let's look at the holistic therapies. The mind-body exercises like yoga, meditation, and mindfulness can help manage stress, improve emotional well-being, and regulate your hormones. Ayurvedic herbs and practices can address specific dosha, imbalances, and support hormonal balance. Consult a qualified Ayurvedic practitioner for personalized recommendations. Supplements. Certain supplements like vitamin D, magnesium, and inositol may be beneficial for managing PCOS symptoms, but always consult your doctor before taking on any of these supplements. Now let's see how to address specific concerns. The first is the menstrual health. Utilize reusable menstrual products and natural hygiene options to minimize irritation and potential chemical exposure. Track your cycle to identify patterns and potential triggers. Hirsutism. Electrolysis or laser hair removal can be an effective option for managing unwanted hair growth. For fertility, if you are trying to conceive, consult a fertility specialist who can discuss potential treatment options like ovarian stimulation or induction. Now let's address your common concerns. The question that I am most frequently asked is, what are the first signs of PCOS? Well, irregular periods are often the first symptom, but others include unwanted hair growth, acne, weight gain, and difficulty in getting pregnant. What causes PCOS? Well, PCOS is believed to be related to hormonal imbalances and genetics. Insulin resistance and high level of androgens are often associated with this condition. How is PCOS diagnosed? PCOS is diagnosed through a combination of medical history, exam, and tests such as blood test, ultrasound, and assessment of all your symptoms. Is there a cure for PCOS? Well, very commonly asked, but there is sadly no cure. But PCOS can be effectively managed and controlled with lifestyle changes, medication, and other interventions. How does PCOS affect fertility? PCOS can lead to irregular ovulation or lack of ovulation, which can affect your fertility. It is one of the most common causes of female infertility in the world. Will I be ever able to get pregnant with PCOS? Absolutely. Many women with PCOS conceive naturally, while others may need fertility assistance like ovarian stimulation or induction. Can PCOS increase my risk of other health problems? Yes. PCOS can increase the risk of type 2 diabetes, heart disease, and endometrial cancer. How do I manage my PCOS symptoms? Well, a healthy diet, regular exercise, stress management, and adequate sleep are all key. Medications like metformin can also help regulate insulin and manage your symptoms. What are the treatment options for PCOS? Treatment options for PCO may include lifestyle changes such as diet and exercise, medications to regulate menstrual cycles and manage insulin resistance, and of course to assist with fertility, as well as management of very specific symptoms like acne and excessive hair growth. Treatment depends on your individual needs and symptoms. Options include birth control pills to regulate hormones, regularize periods, medication for acne and hair growth, and fertility treatments if and at all required. What are the long-term risks of PCO? Long-term risks of PCOS include an increased risk of type 2 diabetes, high blood pressure, endometrial cancer, sleep apnea, and heart diseases. Early diagnosis and management are crucial for preventing these complications. Managing PCOS with lifestyle changes and appropriate medical care can help mitigate all these risks. Can I still live a normal life with PCOS? Absolutely. PCOS doesn't have to define you. With proper management, you can live a healthy, fulfilling life and achieve your goals. Now to conclude, let us have an overview. So PCOS overview is that it's a hormonal disorder affecting women of reproductive age group. The symptoms include irregular periods, hirsutism, acne, and weight gain. The holistic approach is a comprehensive approach addressing all the root causes. It encompasses physical, mental, and emotional well-being. Lifestyle modification is most important in controlling this disease. Stress management and regular exercises are also very crucial. Quality sleep for hormonal imbalances is must. Dietary modifications include balanced diet with whole foods, fiber, antioxidants, and healthy fats, including Ayurveda supporting dosha balances and hormonal equilibriums, dietary adjustments, herbal remedies, and self-massage. Mind-body practices, which includes yoga, meditation, breath work for stress management, emotional well-being, and hormonal regulation. Supplementation and doctor consultation. Consideration of vitamin D, magnesium, inositol, and of course a lot of emphasis on having a professional consultation too.